Now to speak on the spread of the new virus, we have Professor Oyewale Tomori, who is a professor of virology. Thank you so much for joining us at this time. All right, so can you bring us up to speed as to what this new virus infection is and what are the symptoms, the mode of transmission, and how does it differ from other respiratory viruses like COVID-19 and influenza? All right, do we still have Doctor? All right, we still have you. Thank you so much.
Can you hear me?
Yes, we can hear you loud and clear now. You could go on.
Oh, thank you very much. I said this new virus, which is the human metapneumovirus virus, was first discovered in 2001. So it's something quite new. It's not the same as the coronavirus of COVID, nor is it the same as the virus of influenza. The closest member of this group is called the respiratory syncytial virus. And this causes just a very mild cold-like infection. You have upper respiratory and lower respiratory infection. You have it is usually a fever, common cold, and that's basically what it is right now. It's not COVID. It's totally different from it. But like I mentioned, it was a virus that was first discovered in the year 2001, and is now causing some of the problem we are seeing in China. I'll talk about the symptoms, which are very commonly the same thing like a common cold. We have these respiratory symptoms. You have lower or upper respiratory infection, bronchiolitis, and also pneumonia, especially in young children. It is spread by droplets, when somebody sneezes and then passes the virus, which is found in the droplet. When you breathe that in, also the guy who sneezes around can contaminate the environment. And through your touching the environment, you can then get infected by it. So by breathing the droplets or by touching surface which have been contaminated by the virus. It is same things that we use for COVID. It's just the same steps to ensure that it's not that spread. Maintain your distance, apply non-pharmaceutical interventions, good hygiene, and when people sneeze, they sneeze to tissues, and clean up your contaminated area where somebody has been infected before.
All right, so what is the risk of this virus transmission in Nigeria given the country's current public health infrastructure, and what measures can the Nigerian government and health authorities take to prevent the introduction and spread of the virus in the country?
I think COVID has shown us again that the world is, nobody is isolated in the world. In those days we used to think of countries, they are separated by long distances. Today, we are all in the same neighborhood, which is the world. Because of the ease of transportation, people can come in from China this morning. Within 24 hours, they are in Nigeria. So we are also at risk. And the easiest thing, first thing for us today, we know where the virus is, we know where the cases are occurring. And it is our important to protect our border, monitor our border very well. Not the kind of thing we're doing right now, which is a haphazard way. Now it's time for us to seriously monitor, especially we know what is coming from through the airports and all those areas. Those are the areas we should focus on. What NCDC started by getting people to fill in forms, I think we need to intensify that and take it more seriously. Currently, it's a haphazard thing that we're doing, but I think what is happening in China is telling us to take this very, very seriously, and for NCDC to act on the outcome of the forms that the people feel when they come inside into the country.
All right, so how can Nigeria's healthcare system prepare for a potential HMPV outbreak, including enhancing diagnostic capacity, stockpiling PPE, and medical supplies and training healthcare workers?
I'm so glad you raised the point that we need to do. You remember when COVID started, Nigeria was supposed to have had just a few laboratories. Then we went up and built almost 100 of them. But right now, those labs are no longer functioning. Time for us to revive those ones. Remember, we said this is not COVID virus. This is a new virus which was first discovered. So we need the reagents. Our government must go out and look for the reagents for this particular pneumovirus, which, the diagnostic labs must be train our people, provide the reagents for them, and alert people that a respiratory virus is around the corner and is in our position to quickly detect the cases, isolate them, and practice the infection prevention and control that we need to practice to prevent the spread from one person to another.
Looking back, are there any lessons from the COVID-19 pandemic that can be applied to the response to the HMPV outbreak?
Oh, certainly. I mean, COVID-19 has taught us a lot of lessons. Unfortunately, like in this country, we already forgotten those lessons. So we should go back and learn those lessons again, because it is not the first time we're having epidemics. But as soon as the epidemic is gone, we forget and go back to what we were doing before. Time for us to go back and learn those lessons. The first thing we need to do is to decentralize the Nigerian Center for Disease Control. Time has come in the popular political parlance. That time has come for us to restructure our surveillance in Nigeria. Let our states, let our local governments take over disease surveillance rather than a centralized thing that we have at the National Center for Disease Control. In fact, incidentally, the name of National Center for Disease Control is National Center for Disease Control and Prevention. But I'm not sure anybody in Nigeria remembers that name and prevention. Maybe they should change their name and become National Center for Disease Prevention and Control. Then we know what to do at the right time.
All right, thank you so much, Professor, for your time. We really appreciate it.
My pleasure. Thank you very much.
All right, and that Professor Oyewale Tomori, Professor of Virology and now